I'm going to go over the glute bridge today, which is a really commonly prescribed exercise for strengthening the glutes and for low back pain. I will go over form with tips and common mistakes. So for the setup, you want to lay on your back with your knees bent. Ideally, your heels are pretty close to your hips so that you could maybe even touch your heels with your fingertips. If you can't get quite that far, a little farther out is okay. However, having the heels in a little bit closer will help to bias the glutes and take out some of that hamstring compensation. So with the heels farther out, it's easier for the hamstrings to kick in more and to feel it more in the back of the thigh. Okay, so we're on our back, heels slide towards the butt, maybe able to touch with the fingertips. From there, you're going to start with just a little posterior pelvic tilt. So that little bit of kind of tucking the tail, rounding the low back to press it into the floor. Okay, and that's going to help prevent the back taking over and extending too much as we go up. So finding that little bit of tip, core engagement, pressing the low back just slightly into the floor. And then you're going to squeeze the butt to lift the hips. So like I said, you're trying to keep that little tuck so that as you go up, you're not arching your low back. And then you're going to feel it more in the low back. You want to make sure you're feeling the glutes engage. So sometimes lightly touching there and feeling that squeeze as you lift helps with that feedback between the brain and the glutes, making sure we're getting the movement from the right area. So common mistakes, heels way out here, arching the back, so keep that little tilt. And then also remembering to ground into the feet as you press up and not press onto the edges of the feet, wanting to feel that glute activation.